Do you have a way that you approach patients with this information and present it in a way that's understandable so that they can really make a decision and weigh the factors as best they can?
Yeah, I think it's two parts. One, I give them my patient-centered perspective on atrial fibrillation. I start by saying that this is not on its own a life-threatening heart rhythm, that it is a nuisance, but it can be a chronic condition. It can cause you symptoms. It may not cause you any symptoms. It can lead to some dysfunction with the heart muscle or heart valves, or it could lead to no dysfunction of the heart muscle and heart valves. But that the elephant in the room with atrial fibrillation is the risk of the stasis of blood from the top of the heart leading to clots forming and leading to debilitating strokes, and us trying to figure out your risk for that and weigh that against the risk of any bleeding with an anticoagulant. I did share with patients that, especially in an acute illness situation, that it's unfortunate we have no guidelines or clinical trials to go by, but that we use the data that we have and our clinical experience and share decision making with the patients. And that, that if you spoke with 10 cardiologists, you're not going to get the same answer 10 times. But I explained what the annual stroke risk of certain CHA2 vascular is, with caveats that it's not perfect. I think with the advent of direct oral anticoagulants, the risk benefit profile more often than 10 years ago is swinging toward pro anticoagulation. But there are caveats like bleeding, like advanced kidney disease, that I make sure that we take into account and really make a patient centered, individualized decision.